back to my channel. This is Dr. Zina speaking. Today we'll be talking about what is tuberculosis. But before we continue, if you haven't subscribed yet, please do subscribe because it would really help me to grow my channel and reach many dental students worldwide. So let's start now. Now, starting with the definition, tuberculosis is a bacterial infection that commonly affects your lungs but can also affect other areas of your body, like your spine, brain, kidneys, and even your lymph nodes. Now, as I said, tuberculosis is a bacterial infection. The name of the bacteria is Mycobacterium tuberculosis. Now, you might ask me, how does it spread from person to person? It occurs when a person with an active TB disease, primarily in the lungs, releases tiny airborne droplets containing the TB bacteria into the air by either coughing, speaking, singing, or sneezing. People nearby can then inhale these droplets, which travel to their lungs and can lead to an infection. The disease spreads more easily in crowded indoor environments, but people with inactive TB or those undergoing treatment for active TB are not contagious. Now, I said the cause is Mycobacterium tuberculosis. Now, let's divide the words. First is tuberculosis because it's causing the disease, that is tuberculosis. Mycobacterium, bacterium because it's a bacterial infection. Myco, the name is derived from mycolic acid. Mycolic acids are long chains of fatty acids that are important for the bacterial cell wall. And the word myco means fungus because it looks like a fungus. Now let's talk about the different types of tuberculosis. We have three types. First is pulmonary TB, which is seen in the lungs. Next is the extrapulmonary, outside the lungs, any organ outside the lungs like your kidneys, your gastrointestinal tract or the digestive tract, your lymph nodes, your brain, all will be infected under the extrapulmonary TB. The last type is the miliary TB. The way to remember the miliary, if you see in the American movies, whenever parents send their son to the military, they think that this is a serious thing because their son might not return back. So miliary is equal to military, which is equal to the most serious type of tuberculosis because the bacteria can travel throughout our organs by the bloodstream. Now, what are the symptoms for the pulmonary TB? In order to remember, the word cough is the mnemonic. Each letter represents a symptom. C stands for chest pain. O stands for out of breath. U stands for unexplained weight loss. G stands for green or blood sputum. So, meaning that in the end stages of pulmonary tuberculosis, you will start coughing blood, which is known as hemoptysis. Lastly is H. H stands for heavy fever and night sweats. Next is the extrapulmonary TB. The way to remember the mnemonic lungs is used. Always remember, extrapulmonary is outside the lungs, so the mnemonic is the word lungs. Now, each letter represents a symptom. First is the L. L stands for lymph node, meaning that they will have lymphadenopathy or inflamed lymph nodes. As you can see in the picture, this is a picture of a patient with scrofula. Scrofula is the same as TB. It is caused by the same type of bacteria, that is the Mycobacterium tuberculosis. The other name for scrofula is cervical lymphadenitis. Next is the urinary tract. Patients with extrapulmonary TB, they will have urinary tract infections due to the having pyuria. Pi means increase in the production of pus or increase in the number of WBCs, which gives us that the patient will end up having urinary tract infection or UTI. Next is the nervous system. Nervous system, patients with extrapulmonary TB, they will have headache and confusion. Next is the gastrointestinal. They will have abdominal pain. And lastly is the skeletal system. They will have joint pain and back pain. Now we have another classification of TB based on the disease activity. We have two, latent TB and we have the active TB. Under the latent TB, in order to remember, always latent is put on a sleep mode. For example, if you put your mobile on a silent mode, you will never receive messages. You will never know that you received messages because you put it on a silent mode. Similarly, under the latent TB, it's put on sleep mode, meaning that it's not infectious and not contagious. Second is active TB, which is put on awake mode. If you open your mobile's sound, you will receive messages. Because of that, the active TB, it's infectious and contagious. Now, the most important thing, we need to provide treatment for the patients with an active TB because, as I said before, they are infectious and contagious. Now, if you have an active TB, the treatment will be RIPE regimen, giving 4 different types of antibiotics that are rifampicin, isoniazid, pyrazimide, and ethambutol. Also, if you are having the latent TB, even though it is not infectious and not contagious, but you need to receive a treatment so that it won't become active at any stages of your life. But the duration of the treatment for the latent TB is only in the range of 3 to 6 months. Unlike the active TB, where they will receive a treatment for 6 to 9 months or even longer.